Hi, my name is Colin. I'll be your nurse for today. Are you able to tell me your name and date of birth?
1 April 15, 1990.
Okay, and what language do you prefer to speak in?
English.
All right, and are there any cultural or religious beliefs or restrictions that I should be made aware of before starting the assessment?
No.
All right, and at the end of the assessment, I have a health literacy brochure for you. Would you be able to read that?
Yeah.
Okay, all right. So a 1 on the health literacy. So the patient is, the hygiene is appropriate, the height and weight are proportional, and the patient is dressed appropriately for the weather. No involuntary movements. No involuntary movements, able to maintain eye contact appropriately. The mood and affect is appropriate. The behavior and facial expressions are appropriate, and the anxiety level is appropriate as well. So what brought you in today?
Just my annual checkup.
Okay. So do you know where you are?
Yes, Lady Lords.
Do you know who you are?
On that.
Do you know what time it is?
10:15.
Okay. And do you know who the president is?
It is Trump.
And do you know the president before him?
Obama.
Alright, so the patient is awake, alert, and oriented ×3. The speech is clear and the memory is intact. So have you had any headaches or dizziness lately? Okay. Alright, so I'm going to start with this. So what I'm going to have you do is I'm going to have you read this. I'm going to need you to cover one eye and read the top one.
DVOH.
Okay, now do the other one.
DVOH.
Alright. Now I'm going to assess for pearl accommodation. So all I need you to do is just look straight forward. When I come in, shield the eye. Do it to the other one. Okay. What I need you to do is just follow the pen light just with your eyes without moving your head. Assess for accommodation. Okay. So the eyes are perla and they were able to accommodate. So I'm going to do the blink reflex with the cotton ball. So, okay, she was able to blink. So what I need you to do is close your eyes. Right? Then we're doing a facial sensation. So just tell me where you feel this.
Forehead. Chin. Nose. Chin.
Right? You open your eyes. So now what we're gonna do is we're gonna raise your eyebrows. All right, smile, frown, puff out your cheeks, and close your eyes really tightly. All right. So next thing is I'm gonna have you stand up. I'm gonna have you walk a little bit, and then you could walk back. Assessing for gait. You can sit down. Now we're going to do the whisper test, all right? So cover one ear, and then just repeat what I say if you hear it.
1, 2, 3.
Do the other one.
ABC.
Okay. Now what I need you to do is open your mouth and say ah.
Ah.
All right. Looking in the mouth. Now I need you to swallow and say okay.
Okay.
I need you to shrug your shoulders, move your head side to side. Okay. Now I need you to stick out your tongue. All right, move that side to side. So we assessed all the cranial nerves. So cranial nerves 2 through 12 are intact. Now we're going to go to the eyes. So can you just pull down your eyelids? The conjunctiva is pink and moist. The sclera is white, and there's no drainage noted. Have you had any trauma to your eyes, any surgeries, or any drainage?
No.
Okay. So now we're going to go to the ears. So if you could just move your hair a little bit. The other one. All right, so they are bilaterally symmetrical, and there's no drainage noted. Have you experienced any hearing loss lately, or any pain in your ears, maybe a lack of balance? No? Okay. Now we're going to go to the nose. So we're going to say that it's symmetrical, bilaterally symmetrical, and there's no nares, there's no exudate, no runny nose or anything. Now we're going to do nasal patency. So all I need you to do, the sniff test, so all I need you to do is close one, sniff out of the other, and then do it to the other one. Alright, so the nose is bilateral in nasal patency. Now we got the mouth, so I need you to open your mouth one more time really wide. Alright, and let me see your teeth, big smile. Alright, so the teeth are white, smooth, and intact, and the lips, tongue, gums, and buccal mucosa are pink and moist without any lesions. For your nose, have you had any facial pressure or any nosebleeds recently? No. What about your mouth? Have you had any like a sore throat or any trouble swallowing? None of that? Okay. So next we got is the head and neck vessels. So the patient's skin and lips are appropriate for or normal for ethnicity. There's no pallor, no flushing of the skin, and no cyanosis. So now we're going to do a JVD. So if you could just look to the side and up. And to the other side. Alright, so there's no JVD noted. So we're going to look at the lower extremities. Okay? And they're the same in temperature. They're bilaterally symmetrical in size. There's no lesions, no ecchymosis, normal hair growth, and normal hair color. And there's no edema. So now I'm going to do capillary refill. So let me see your hands. Alright, so the upper and lower extremities for capillary refill are less than 2 seconds. So now I'm going to listen to your heart, okay? Alright, so apical with the diaphragm, pulmonic, Erb's point, tricuspid, mitral, and now I'm going to listen to the apical for 1 minute, stating normal rate and rhythm. Normal rate and rhythm between 60 to 100, 72 beats per minute. Now I'm going to flip over to the bell to find to see if there's any murmurs. So for the mitral, tricuspid, Erb's point, pulmonic, and aortic. No murmurs heard. Alrighty. So the next thing is I'm going to do your pulses. Okay. So I'm going to do the carotid, 2 fingers. Okay. Have your hands out. Now we're going to do radial pulse bilaterally. You just bring these up a little bit. All right, now we're going to do the brachial bilaterally. We're going to come behind the kneecap, popliteal, posterior tibial, dorsal pedialis. So all pulses are bilaterally symmetrical, +2, and regular. So now we're going to go to respiratory. So as we look at the patient, respiratory, normal breathing pattern, regular breathing pattern, no use of accessory muscles. So all I need you to do is just stand up real quick, turn around. We're going to assess for the diaphragmatic expansion. So all I need you to do is take a deep breath. All right, so the diaphragmatic expansion is symmetrical. So I need you to turn around for me. All right, did you say 99?
99,
Turn around.
99, 99, 99.
Okay. So normal vibrations for tactile fremitus, for anteriorly and posteriorly. So I'm going to listen to your lungs. So every time I put it on, you're going to take a deep breath, say 99E, and whisper 1, 2, 3, okay?
All right. 99E. 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 99E.
All right, turn around.
99E. 99E. 1, 2, 3. 99E. E. 1, 2, 3. 99 E. 99 E.
Okay. So you could sit down. So the lungs are negative for egophony, bronchophony, and whisper pectoriloquy. There's no adventitious sounds, and they are clear to auscultate. So have you had any shortness of breath? Any prolonged cough? Have you had any palpitations? Okay. So what we're gonna do now is we're gonna go to the table. So if you could just lay down for me, and I'm gonna assess your stomach. All right. So the stomach is round in contour, equal in symmetry, and there's no lesions, no rashes or striae. So what I'm gonna do now is auscultate. Okay. Okay, so normal bowel sounds in all 4 quadrants. So now I'm going to palpate, so let me know if it's tender or not. Is that tender? Okay,
Yeah.
so it was non-tender. Now I'm going to do the bladder. And it is non-palpable. So you can put your shirt down. So while you're up here, I need you to just bring your leg up. Bring it away, bring it toward me. All right, now resist. Resist. Do it to the other leg, bring that one up. Bring it toward me, away from me. Resist. Resist. All right, now you can swing around. Okay, so what I need you to do is bring your toes up, bring them down. All right, so resist and resist. All right, and when you do follow my motion, bring your hands up and then over. And what I need you to do, bring your hands toward you, away from you. Resist, resist, perfect. So the posture is erect and the shoulders are equal in height. So now we're gonna assess for kyphosis. So no kyphosis, no lordosis, and there's no scoliosis. Alright, so now we're gonna go to the last one. So normal skin color. Have you had any rashes or any itching lately? Have you had any joint replacements or any trouble walking? Okay. Skin's without any lesions or any rashes. Hair is evenly distributed. Hygiene is intact. A normal nail color. Yep. On the upper and lower extremities. There's no clubbing to the upper extremities on the fingertips. The nails are not dry. They're not brittle. Skin is moist. And it is warm in temperature. And then the skin turgor. Skin turgor is appropriate. It's normal. Have you experienced any excessive sweating, like diaphoresis? Have you experienced said you already had experience, you don't have trouble walking. Have you had any nosebleeds? Any drainage from your nose, or your ears, or your eyes, or anything like that? Okay, so the muscles were a 5 out of 5 on strength. And I said that the cranial nerves were 2 through 12 were intact, and the muscles are bilaterally symmetrical in size, upper and lower extremities. Have you had any constipation or any heartburn?
No.
Okay.